Hey everyone, welcome back to my channel. I'm Sheila G the PAC, and this is another video about two skin conditions that look very similar but are in fact very different as far as their cause and treatment. For all things dermatology, don't forget to like, comment, and subscribe to my channel. Let's get started. So the two conditions that we're going to be talking about today include nummular dermatitis or nummular eczema and Tinea corporis, which is a fungal infection on the body often referred to as ringworm. Now both of these conditions look and behave very similarly in that they present as round, scaly, often red and inflamed patches on the skin that can be pretty itchy. They also present in similar locations on the body, such as the arms, legs, and the trunk. Now, although these two look very similar, they're very different as far as their cause and the treatment. So making the correct diagnosis is very important, and I'm going to explain all the differences. First, let's talk about nummular eczema. Another name for this is discoid eczema. And eczema is just this broad term that we use to describe different dry skin conditions that involve a dysfunctional skin barrier. So nummular eczema is more of a subtype of eczema that literally means coin-sized. So it presents as coin-shaped, dry scaly patches on the skin that can be quite inflamed, typically on the arms and the legs. Now, these can be mildly itchy or very itchy on the skin. They can present as one singular lesion or more commonly multiple lesions that erupt and kind of come and go, and that's the more typical presentation that we see. What's interesting about this type of eczema is that although it may be a manifestation of atopic dermatitis, which is the most common form of eczema that we normally see start in childhood, this can occur suddenly in adulthood with no past history of eczema and with no identifiable cause. But as far as other causes that we might see for nummular eczema, that would include an allergic contact, an irritant contact on the skin, or even just dry skin in general. When the rash first erupts, it may ooze and form a crust. We call that the wet phase. But over time, in a more chronic phase, the skin just gets very dry and thickened. The treatment for nummular eczema includes anti-inflammatory medications such as topical steroid creams and heavy moisturization. However, there are some prescription anti-inflammatories that are non-steroidal. The goal is to reduce the symptoms and hopefully eliminate the rash, but in more chronic forms, we can expect it to reoccur at some point. Now let's talk about Tinea corporis, aka ringworm. Tinea refers to a dermatophyte infection, which is a type of fungal infection. Corporis just means on the body, more specifically the extremities and the trunk. Tinea corporis is contagious as it is caused by fungal spores that are spread from infected skin. It more often occurs in the setting of a warm, moist environment. So risk factors include living in a hot, humid environment, physical contact with somebody that has a fungal infection, so sharing towels, bedding, things like that. Also, some other risk factors include having diabetes, immunosuppression, and also having house pets, as fungal infections can transfer from animals. Tinea corporis typically starts as a red patch with surrounding scale. Then usually, as the lesion grows outward, the center of it becomes more clear, and then there is a red scaly edge that forms at the periphery called a trailing scale, and that forms a ring shape, hence the name ringworm. The edge of the lesion may also be bumpy and have pustules. Now, sometimes if the infection is long-standing, you can have multiple lesions kind of forming in a cluster, and then over time, they coalesce with one another to form a larger patch on the skin with that trailing scale, with that edge that is very bumpy and very well-defined. Now, tinea might also be very itchy in most cases. If left untreated or treated improperly, the rash may spread to larger areas of the skin, and that can be harder to treat. Now, something very funky that can happen with fungal infections is it can cause something called an id reaction. An id reaction, the best way to describe that is basically like an allergic rash that happens elsewhere on the skin at a different site in response to that fungal infection. So that can make the diagnosis a little bit harder in those settings, but it doesn't always happen. Regarding treatment, Tinea corporis requires antifungal medications, topical, and sometimes oral medications are added as well. We tend to favor the azoles, which are ketoconazole, econazole, clotrimazole, and then we have fluconazole, which is an oral antifungal. Now, one of the strongest antifungals is terbinafine. Another name for this is Lamisil. So there are over-the-counter treatments for tinea that are a little bit weaker but can still be effective, and those include clotrimazole, topical terbinafine, and tolnaftate. If you go to your dermatologist and the diagnosis is not very clear, we might either do a biopsy or a skin scraping where we can see if there's any fungal hyphae under the microscope, and that confirms the diagnosis of Tinea corporis. So why do we care so much about getting the diagnosis right between these two rashes the first time around? Well, obviously we want to treat the patient as soon as possible and relieve their symptoms, but also we want to avoid something called tinea incognito. And basically what that is when an actual fungal infection is misdiagnosed as a form of eczema and then is treated with topical steroids. What happens is when you apply steroids to a fungal infection, it may actually start to look and maybe even feel better for the patient. But once those steroids are discontinued, the rash comes back 10 times worse. So the idea behind this is that the steroid is going to reduce the inflammation that's part of the fungal infection, but it's not actually going to kill the fungus that's there. In fact, it's actually going to feed the infection and make it worse over time. Well, simultaneously, it's altering the appearance of the rash, making it harder for us to diagnose. And again, once those steroids are discontinued, then the rash erupts and it's way worse and it can be harder to treat. So being able to detect the small differences between these two rashes takes years of training and experience. So for any skin condition, as always, see your dermatologist so you can get the correct diagnosis. So there you have it, the difference between nummular eczema and Tinea corporis. If you found this video helpful, again, don't forget to like, comment, and subscribe to my channel for all things dermatology. Thank you so much for watching, and I'll see you next time.